most famous physical therapist on the internet.
Oh, we're ready to go already? Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about the big lie about trigger points, which are knots, and how to get rid of them. This is an updated one, by the way. You didn't put that on the title. This is
I'm sorry. Make sure you get that on there,
yeah,
Mike.
so we did this one in the past. We thought it was time to redo it, maybe with a little bit more knowledge. We've become older and wiser.
Yep, a little more clarity. I think this is going to be a better. It's going to come. People are really going to
Understand it.
Well,
better.
it's a notch up, Bob.
All right. If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Are we giving away the mattress, Mike?
Oh.
You're going to want to join us on it. You're definitely going to want to join us on our website, bobandbrad.com, because right now, go to the giveaway section, because right now, this week, we're giving away a mattress and also a pillow. Sleepovation, our favorite mattress, our favorite pillow. You can also find it on Facebook, Bob and Brad. And if you want a short version of us, go to Twitter or Instagram, 60-second version of Bob and Brad every day.
There you go, Bob. I'm telling you, even this Sleepovation mattress could give some benefit to knots.
Oh yeah, absolutely.
Well.
If you're, I mean, it's a great pain relief mattress. That's what that wasn't good enough for you?
No.
Okay.
No.
All right, let's go, Brad.
Anyways, so yeah, we got to get to the big lie, because people want to know, well, trigger points or knots. What some little more detail or technical name for them? You're going to say it, Bob?
They're also called myofascial trigger points, but they're a point of hyperirritability. Spot.
Right.
Was there something else you were looking for?
Well, no, I thought we should at least say the technical name so we sound like we know something about it. But we see them all the time in therapy. People come in, and probably one of the most common place is right back here on that shoulder. They get that tension spot, and people say, "Boy, I've got that just knot."
Yeah, that upper trapezius, very common
right.
area.
But you can get them, in the low back is very common, maybe in the hamstrings or in the calf. But we're going to talk about this because it's probably the most common.
Right.
So
it's a good example.
Right. So what is the big lie? And we've got a couple different.
Well, first off, with
this.
trigger points, it is a bit controversial. People, I mean, there really is a lot of question marks out there about what they are. And to give you a little history, Brad, I don't think you know this. Way back in the early 1920s or something like that, they actually thought it was myositis, they called it, and they thought it was a problem in the muscle itself.
Sure.
And now we're finding out what?
It's a reaction from a different problem, and we're going to get to that in just a little bit.
Exactly.
But oftentimes people think you got knots. You need to go to a masseuse, a massage therapist, and get the knot relieved. And oftentimes it works well, but it doesn't get to the origin of the problem.
Right.
And the knot comes right back, and they need to keep going through the cycle. Massage therapist, masseuse, and back. And, maybe some people like that and can afford it.
Right. But it's a temporary fix, basically, is what you're saying. So
right.
what we're trying to do is get rid of the knot for good.
Right.
Rather, as opposed to having you go on the pain cycle.
So how do we assess? Bob and I will do this. Let's say someone comes in with that. Why don't you turn around, Bob?
Sure.
Stand up, take a bow. I'm just kidding. But right here, we're talking that pain here or over into the shoulder blade, and it just all knots up. One of the things I'll do is I'll say, have a seat. Why don't you sit down? We'll pretend Bob's the patient. And Bob, Bob already tells me the pain is here. It's at a 5/10, and it goes up to an 8, 9/10. And so, Bob, can you just do a chin tuck like this?
Okay, I'm going to go.
Oh, there you go. And then oftentimes what will happen, I'm going to talk for Bob, you say, oh, that makes the pain worse, but the pain often feels like it's going more towards my center of the back, towards my spine. If that's the case, in my mind, I'm thinking already, there's a really good chance it's not a muscle problem. The problem is in the neck, the low neck. Very common. Oftentimes, other things I'll do is, can you look back up towards the ceiling? And what will the patients oftentimes say when they do this?
Well, sometimes it doesn't help, and other times they'll say, "Oh, it starts to feel better in there again." And the point Brad's trying to make here, which I think he's doing a pretty good job, is that if it's in the muscle, it's not going to change. If the problem's in the muscle, that pain isn't going to suddenly go out and go into a different area.
Right.
It's going to stay into that muscle.
Right.
But when you do some of these, you might go here. It might even go to the other side.
Right. And that's not uncommon to have
Yeah.
pain move around just from movements in the neck with this problem. So if it is moving from here towards the center of the spine, the muscle, if it was just a knot in the muscle, the knot in the muscle cannot move.
Right.
But you perceive the pain, and we're going to talk about how to correct that in just a little bit.
Right. So if the pain moves, it isn't a muscle problem. It is often from the neck is what sends pain into the upper trapezius.
Right. And oftentimes it's from a postural problem. Head forward.
Very common.
In our society, people sit with poor posture. We look at our phones with poor posture, computers,
everything's
TVs.
head forward, everything's head down.
Yep.
You know, and you're looking at your phone all day, and so we, I know therapists known as the posture guys, but there's a reason we're trying to get rid of the problem permanently, not just temporarily.
Right, exactly. So if these things change the pain, move the location of the pain, we will go right after the neck. Okay, so how do we correct it? We're going to give you a few hints. The first one is going to be in a seated position, Bob, chin tucks. Sometimes just chin tucks can do it. And we've had a lot of comments on our videos, people commenting, saying, oh, the chin tucks has helped me a lot.
Yeah, because one thing you can do throughout the day, and you should, this is not just an exercise to be done once a day.
Right.
This is to be done like every 20 minutes, every hour.
Right.
And remember, you're not going down like this, and you're not going up like this. You're going straight back, and you can even give a little overpressure.
There you go.
Just give a little overpressure, pushing a little bit on the chin, go into the crook of your thumb there.
Not aggressively.
Not aggressively.
And if this makes it feel every time you do it, it feels a little better, or the pain seems to move more towards the spine, you're golden.
If it makes it worse, if it goes even further down into the trapezius, then you need to stop it.
Right, right. So a lot of times, I probably have most success using the towel. Why don't you go ahead and show Bob? And then we're not doing chin tucks with the towel. We're doing extension or looking up towards the ceiling.
This is especially helpful with a lot of times I have people try it first without the towel.
Yep.
And they go, it hurts.
I can't. It's not fun.
It doesn't fun. Yeah. So then we start with the towel. And Brad's kind of talked me into this method more than I used to go more like this.
Yep.
I still do sometimes.
Yep.
But a lot of people seem like they do well pushing down like this. So I'm pulling down.
Sometimes or oftentimes I find that if they get the towel down low, lower the better.
Yeah, I sometimes I start them up a little higher, and then I try to have them work down.
Yep. Because
they seem to, but you're right, Brad. It's that C6, C7 that they like to support at that.
So he's talking about low neck vertebra.
Right.
So what's going on? What we're boiled down to is the spine itself, and I'm not going to get into the anatomy and the details of it, but it's the problem is in the low cervical spine, and it radiates or refers pain over to the muscle, and then the muscle reacts by tightening up. Yeah.
And once it gets into that tight position, sometimes it's hard to break it out of that pain cycle.
Right.
So you got to find what you always call it, directional movement, or what you
right. Yeah. Directional movements to
find out how to relieve the pain.
And once you find that specific direction, you stick with it.
For other people, it might be side bending.
Right.
But and that's where we have a lot of videos and where we get into great detail. But that's a great start. Chin tucks and extension with a towel.
Exactly. And oftentimes, if that's working, you can also do a mid back stretch. Now, if you've got a knot and it happens to be not here, but down between the shoulder blades, this one will oftentimes be helpful.
If you're pretty rounded here too, way up in the upper thoracic, even a little bit of the lower cervical.
Yeah, the little hunchback.
A lot of times the ball will work. And we've done videos on this before too. You can just get a ball from one of the big box stores. Brad likes it a little bit flatter.
I do.
So
you're not going to use a basketball.
No.
It's got to be. Has to be.
It's a little more comfortable.
Right.
And
a little more.
What's nice about this, I'm sorry, I didn't mean to cut you off.
It needs to be forgiving or a little bit soft.
So and you can move it up and down then.
Yes.
Now I'm a little bit taller, so I can't go too high here. Maybe you want to do this one, Brad.
Okay. Yeah. Bob would need a taller chair.
But Brad can go up higher into that area where it kind of gets into that spot.
And then I just work it back, and you can change positions. You can bring the arms up like this, back like this, and sometimes I like to grab the armrest and use that and use some force. But it should feel good. If you got pain, if it goes towards the center of the spine with repetitions, that's a good sign. Typically, 10 repetitions at one time is more than adequate.
Yeah, the key is not how many you do right at the time. I think it's the fact that you do it throughout the day.
Right.
And that's what's nice about the ball. Again, just keep it by your chair. If you're an office worker, and every once in a while, go ahead and put it back there and,
Sure.
and rip some of them off.
You could do a double header. Why don't you give me the towel roll? Use the ball and the towel.
There
I've got to
you go.
admit, I've never had any patients do this, but I wouldn't.
It just came on you.
Yeah, I just thought about it right now. It's like, yeah,
It actually would work.
yeah.
I see no problems with that.
It's one of those things. If it feels really good while you're doing it, and when you get done, you're golden. It's going to improve.
Is there anything else you want to talk about, Brad? Or
no, I don't know what time we're at because Mike forgot to take the
Mike
clock.
put the timer on. So we better remember, Brad and I are not just pretty.
We're pretty ugly.
No, we're pretty handy and
Handy.
helpful. So make sure you subscribe to us. Thanks for watching.